afternoon, everybody. Why I'm saying good afternoon is because this room still emits the same light what the sun emits. नहीं, आप पीछे मत देखिए, आप ही से आ रहा है सर. प्रकाश इतना है कि चकाचौंध हो गया वहाँ. You'll have to forgive my voice. Do I do my PPT or I talk from heart? What do I do? फिर तो मार पड़ेगी. Friends, I have discussed earlier also 2 points, and what I wanted to talk is one example of success which we saw in medical field, and same we are trying to do in the road and transport department. In the last few years, we saw a fantastic example of medical change. Did I discuss this before here ever with you, what we did in Haryana? Sure? ठीक है. Then I would like to ask you something. Can I speak in multi-language or only English? हिंदी में चलेगा? और मराठी में? ठीक है. प्रवीण जी के साथ तो राजस्थानी में, मारवाड़ी में भी बात कर सकते हैं. अच्छा, इसमें से बड़ा ऑनेस्टली बताइए, आप में से कितने लोगों को लूज मोशंस हुआ है? नहीं, कभी ना कभी वो ऐसा कोई है कि हाथ ऊपर कर सकता है? सर आपके यहाँ पे ऑनेस्टी नहीं है. देखिए मुझे हुआ तो मैं यहाँ पे, कितने लोग होते? चंपक भाई को कभी नहीं हुआ. हुआ तो हम, व्हाट इज द सॉल्यूशन टू इट? हम क्या सॉल्यूशन लाते बताइए? एनीवन कैन टेल मी द सॉल्यूशन ऑफ दिस? हाँ, कौन सा ओआरएस? जस्ट कैन यू जस्ट स्टैंड? दीपक साहू जी उनको एक लैपटॉप गिफ्ट में देंगे. So ORS ले लेते, right? That's the whole simple thing. As you said कि speak from heart, I'm trying to speak from heart. It's very easy. One thing is that we can do that. उसका reason क्या हो सकता है सर? Can you now tell me what is the reason behind this? गलत? Yes. Infection. Something else? Bacteria हो सकता है. तो आप उसको avoid कैसे करेंगे? Avoid करने को कोई नहीं बता रहा. Nobody is trying to tell me about the how do we avoid loose motions. Any case here? Yes sir, you have something. Yeah, the senior gentleman. Do we have a mic here? He said something very nice. हाँ, यहाँ पे. प्राजी आप बता रहे, थोड़ा जोर से बता दीजिए.
And take quality food.
Take quality food. Fantastic. Somebody else who has some other ideas? How do you avoid this? Now I'll give you an example, and this happened, and then it will tell you. This happened, and this is a real case which has happened. I come from, my lineage comes, otherwise I'm a Mumbaiker, I'm born and brought up in Mumbai, but my lineage comes from Hisar, which is their place called as Akroa Dham. आप में से किसी लोगों को पता होगा तो that's the background. Now in Hisar, one of the companies under its CSR program decided to put a medical center. Jiten bhai, you will agree, right? अगर free में हुआ तो हम लोग भी चले जाते हैं ना. So now what happened is, there they used to have this problem of loose motions. And you go to doctor, doctor gives you a tablet, you eat the tablet, problem is solved, right? One single tablet, ना एक ही गोली खाने से हो जाता है. So people go, they eat tablet, they forget it. Sometimes again when it happens, you go eat it. Then rightly said by the senior gentleman, you avoid certain food. Particular allergy भी हो सकती है क्या? ये चीज खाया तो भी होता है, ऐसा भी होता है चंपक भाई? Sometimes you eat something and it can happen. So people started deciding, ये खाएंगे नहीं खाएंगे. Now when this company put this box there, so this particular box was little more. It had intelligent people like you. The hospital was connected with Bangalore. I don't know whether it was Apollo or it was Manipal, but it was connected with some hospital. And one particular day, somebody in Bangalore said, यार ये हिसार में केवल औरतों को डिसेंट्री क्यों होती है? Any answer? Only female members. Are there female members in this room? My sincere apologies. We understood. Now the second thing is, it only happened on Tuesday. So they started talking to the person who was giving medicines there in that Hisar. So he checked. He said, "Arey Bimla auntie, you come here every Tuesday." Somebody understands Haryanvi here? थोड़ी बहुत आपको तो आती है कि सर बोला ताई तेरे को हर मंगलवार क्या हो जाता है बोले मर मरे तू मेरे को मेरे पीछे क्यों पड़ा है टाइप्स यू नो बट देन शी अंडरस्टूड नेक्स्ट ट्यूसडे शी वाज अगेन देयर एक गोली खाया बीमारी ठीक हो गया शी पॉप्ड इन वन टैबलेट एंड थिंग्स वर ओके following Tuesday again there was problem she popped in one more tablet things were right but third Tuesday she realized कि बात तो सही कर रहा है मंगलवार को ही होती है Sir, you are very senior people here. You are very intelligent. You have done businesses. Is it possible every Tuesday you have dysentery? What will be the cause, sir? Monday कुछ overeating कर लिया है, कुछ exertion कर लिया होगा. Now the team sitting in Bangalore started counting और बात को और narrow करते उनके ध्यान में आया कि these particular ladies who were having this problem. Before I say this statement, let me tell you, I am politically correct. I do not subscribe what I am going to tell you right now. This is not my statement, but this happened. And God forbid my country will never have that problem. But उनके ध्यान में आया कि upper caste ladies को ही होता है. This is first to study. तो उसे सर कह रही फला ही community में होता है, दूसरे community में नहीं होता है. How is it possible? And Tuesday. Now they started to study. Any guess what was the problem in this room? Mike. Exactly. I knew some intelligent person will be certainly there. But so.
The food of Sunday, food made on Sunday or, maybe eggs or chicken or,
Okay.
they were not being transported to the city on, so Sunday का खाना Monday को transport होता था. And it used to be one day stay and.
Correct. So maybe it is a food problem, right? So they started telling them कि क्या खाया था मत खाना. So the ladies avoided the food. उपवास कर लिया. But Tuesday को फिर से motion हुआ. Now Jitin bhai, what is the answer? And just understand. Now can a doctor, GP can zero down saying that कि ये problem आपको होगा और हर मंगलवार को होगा, अगले मंगलवार को भी होगा, and this will happen to only this particular community. You know, what was this? This was the e-health center provided by one of the companies, which was there. So the doctor was there. When it was reading up, the data is to travel to Bangalore. The data was read up. And they understood that this is the same person who is coming every Tuesday. There is no new person. These 20-25 ladies come every Tuesday with the same problem. चवन्नी का गोली खाते ठीक हो जाते. Any doctor here or who somebody has some little bit knowledge of doctors here? So a statement is very simple. If you have trouble, you take tablet, you are okay. Is this okay? This is correct, right? That's the only way it has to be. और उसमें क्या बुरा माना, उसमें क्या चर्चा करने? Why are we discussing this on this particular platform, a fantastic platform of VAR? Deepak Shahu has gone crazy. Why should he bring me here to talk all these problems to you for last 3.5 minutes? How did they come to know about this? They came to know about this because that particular medical center had some IT element inside it. This IT element would transfer the data from Hisar to Bangalore. There were no doctors. There were no man. There was an analytical tool which was telling that this person is coming again and again on this day with the same problem. Then we came in picture. There was a team which was formed, studied, क्या हो गया, कैसे हो रहा है. And you will be surprised to know, Jitin bhai, it was not food. बिकॉज वो तो उपवास करे तो ओवर ईटिंग वाला प्रॉब्लम ही नहीं ना पाजी. They did upvas, so there was no problem. All the senior ladies on Monday morning is to go to one particular temple. शंकर जी को जल चढ़ाया, take the water and drink it. और वो पानी शायद contaminate हो रहा था और उससे उनको ये solution क्या है अभी इसको? You can't stop religion, right? Solution was very simple. Sunday के दिन everybody came together, they cleaned the temple. भस्म आरती करते हैं, ऐश से साफ करते हैं पूरा, डिटॉक्सिक करते हैं उसको. इट्स क्लीन एंड वंस इट इज क्लीन ऑन संडे, मंडे यू कैन अप्लाई एंड सी द रिजल्ट. द रिजल्ट इट नाउ नेक्स्ट ट्यूसडे देयर इज नॉट अ सिंगल पेशेंट ऑफ लूज मोशंस. यू अंडरस्टैंड द सीरियसनेस ऑफ दिस टॉपिक. सोल्यूशन इज नॉट मेडिकल. Solution कहाँ था सर? Somebody in the room? जोर से सर. Can you pass on the mic? Okay, one is hygiene, second. लेकिन वो तो identification कैसे करेंगे? Hygiene is the result, right? चौबे जी, exactly. So here comes the second laptop from Deepak Shahuji to Chaube ji. Exactly. The problem was medical, but the solution was not in medicines. The problem was medical, but the solution was in IT. Getting it? So we will have to change the way humanity runs. We will have to change thinking. समस्या कहीं पे भी होगी, लेकिन उसका समाधान जो है ना, वो IT से कैसे निकलेगा? And there comes, I think, VARINDIA. There comes people like you who can think that, okay, there is a problem, come to us. You have a medical problem, come in this room, we will give you a solution. You have a hygiene issue, we will give you a solution. You have a social issue, we will give you a solution. The difference in that particular medical center was not that they had a good doctors, because doctors were giving the same tablet. The difference was there, it was connected, there was a data analytical tool behind it. Somebody was running analytics behind it and could identify that there was a problem. And once the problem is identified, then we can go to the root cause of the problem, right? And the root cause many times is surprisingly not a medical issue, right? It can be anything. Just think about that. In place of the old ladies, it would have been my young sister, your daughter, and she pops up tablet every Tuesday. Your generations to come will change, right? आने वाली नस्ल के ऊपर हर दवाई का फर्क पड़ता है. So IT not only saved the patient from the pain of disease, but also saved our money and also the generations to come. What I'll quickly do is take certain facts and the figures in your front. How much minutes do I have? 5 more minutes? In the last 3 years, I would like to put in some facts and which will tell you what the government is doing and how we are doing it efficiently. The GDP in 2013-14 was 6.9 and which has been perceived as to be more than 7.5 right now, if you see it. The inflow of FDI, it was over 24.29. We are going to touch somewhere around 37 right now. It's a fantastic barometer of growth which can be seen. Forex reserves, when we came in power, it was not even 304 million. I don't know the figures of this year, but last year we had crossed 340 million, a substantial jump, almost around 11% jump. Now we can contribute this to the oil pool, that's okay, but probably we have done fantastic forex. Whereas we as an IT have been importing the biggest second bill. I have certain figures which I would like to read out, and maybe probably I wish I had a PPT here. The total number of startups grew by 40% in last year, that is year 15-16. Almost around 4,200 new startups added in this entire country. Each startup is a new business opportunity, new idea. What I talked about before this, the medical solution, was a startup, right? It's a new way the life will be. Entire startups itself gave an opportunity of almost around 80,000 jobs in the country. You will be surprised to know almost around 19,400 technology-enabled startups. Even if I take, say, an employment of 10 to 15 people per startup, you can see the numbers. Let us talk about what are the numbers in the funding. India startup raised 3.5 billions in funding in the first half of 2015. The active investors in India increased from 220 to 490. In the global market, with the current slowdown, the challenges which you are seeing in certain parts of the economies like IS or established economies, probably this is going to be a fantastic barometer to count upon. Venture capital backed companies topped almost around 12 billion, that is almost around 82,000 crore rupees. And there were no less than 1,200 deals in the last 2 years. It talks about the environment in the country and the efforts which the executives are taking. Probably few of you would be interested to know what we do in the task force, and that will also tell you we are committed for e-governance, that is transparency through IT, speed through IT, scalability through IT. Last year I said I was unable to speak because we were making the report and I was asked not to speak till the report is finalized. But nowadays out, right? Do you see in the shipping ministry, in the road ministry, the highway ministry, railways, how many tenders come every day? Probably we could have done this last 10 years back. You'll have to forgive me, it's not a political bias. But what study was done in last 2 years and which resulted in so many tenders coming there on the government platform, had that been done 10 years back, we would have done the same thing, right? I was so let down and sorry to go to a port in Calcutta and see that it does not have a surveillance cameras. Not to the face, they had cameras, but not to the face. And as a task force member, we put it as one of our remarks. आप सबने तो बहुत धंधा किया, राइट? सरकारी ऑफिस का सबसे अच्छी बात क्या लगती है बताइए? टेंडर निकालना अच्छा लगता है ना उनको? कि नहीं? आप यस बहुत धीरे से बोल रहे हैं कल. Right? It's there. It's fact. And what do you like most? To see tenders on the screen, right? Each tender brings opportunity. Every tender, and if you go right now, the amount which has been spent on IT in each department, road, highway, transport itself. If you just go there, IPA has put in tender of 4 ports, 300 man-months consulting tender. Now, whether it will go to person A, B or C is not my concern, but if you see how much opportunity is coming out, you will be happy to know that in 2016 and 17, the total tech initiatives which were there, on the railways itself, if you talk about, more than 100 stations have got Wi-Fi. We are planning for another 400 stations. Ticket vending machines, automatic ticket vending machines, almost around 17 and 80. Each ticket vending machine comes and somebody in this particular room gets an opportunity, Deepak bhai. Every ticket vending machine. More than 2,000 stations have been provided with screen which will enable them data. Every time you enable the IT in railways, some passenger is benefited out of that. Every opportunity is being used by this ministry and the ministers and the Prime Minister to involve IT. We have talked about broadband connectivity. If you see in the last few days, you would have seen the satellites going up. I'm sure the total spectrum will increase. As the spectrum will increase, we will try to connect yourself with the grams. We are committed to go to the last gram. One particular scheme I'll talk to you, maybe it is not directly related to you, but it will talk about the commitment the government has. How many of you have visited Arunachal from here? Sikkim? Sir, there is a scheme if you go to the net. It is Northeast BPO Promotion Scheme. Each of you here is invited to participate in this. 1,500 seats of call center. I have worked in IBM, so I know how much it costs. And see the scheme, fantastic scheme. Almost around ₹1,00,000 subsidy will be provided. 6,000 rupees to train the agent sitting there. commitment of STPI to connect. In case you don't have place, STPI is ready to give you place. State governments have been requested to give you fixed business of call centers there. वहाँ पे भी कोई किसान का चल रहा है call center, वहाँ पे education का चल रहा है. I'm deliberately putting to you all this particular case because I like this forum. As an IT man, I know that finally if this has to be delivered, it will not be delivered by IBMs or Dells or Cisco's, but it will be delivered by validated resellers like you. You are the connecting piece between us and the technology. My request to you all is to go to the screens, check each government department. There is a hell lot of opportunity coming up. There are many more things in this paper which I could actually read, but if in case you want to read this, I'll try to put this on my Facebook and you can read it from there itself. I'm also more eager to listen to other people who are going to come and speak here. What I'll do is rest my case here right now. In case there are questions, I can take 1 or 2 questions. What is the design? I don't know whether the organizers want me to take that questions right now or later on. But yeah, so probably we can do that. I would like to thank each of you to give me a patience hearing. Thank you very much.